Allergic Conditions of the Skin, Chapter 24, a review from the classroom and the Lewis textbook. Successful contact dermatitis treatment consists primarily of identifying what's causing the inflammation and then avoid whatever it is that's causing the inflammation. The rash would usually resolve in like 2 to 4 weeks. Self-care measures such as wet compresses and anti-itch creams can help soothe the skin and reduce inflammation. The symptoms include a red rash or bumps, itching which may be severe, dry red patches which may resemble a burn, blisters and draining fluid from the involved skin in severe cases, and the skin rash is usually limited to the exposed area. This picture shows an allergic contact dermatitis, which is a reaction to a temporary tattoo. Common triggering agents include poison ivy, poison oak, nickel, soaps, detergents, cosmetics, rubber, latex gloves, and even neosporin can cause contact dermatitis. Medical management is prophylactic measures, just avoid the known irritants or triggers. Topical treatments and symptomatic relief include keep the skin moist with lotions, cool compresses, oatmeal preparations, antihistamines, and topical steroids. Now, systemic steroids are reserved for very severe cases. Urticaria is also known as hives and is both a clinical description and a disease. It is characterized by superficial, localized, intense edema. Usually it's present acutely but can be chronic, lasting more than 6 weeks. It is caused by a release of vasoactive substances like histamine and prostaglandins from mast cells in a type 1 hypersensitivity reaction. The reaction ranges in severity from scattered itchy bumps to life-threatening anaphylaxis. The triggers can be drugs, food, a virus, insect bite, physical stimulus, or stress. Chronic urticaria is usually idiopathic. Medical management includes systemic antihistamines. Steroids and epinephrine can be used in severe cases. The most common immune response to a drug is due to the expansion of T cells and a type of white blood cell that recognizes the drug as foreign. These T cells orchestrate a delayed immune response that most often affects the skin, causing itchy rashes, and occurs days to weeks after exposure to the drug. Most allergic reactions occur within hours to 2 weeks after taking the medication, and most people react to medications to which they have been exposed to in the past. This process is called sensitization. The rashes may develop up to 6 weeks after starting certain types of medication. The most severe form of immediate allergic reaction is anaphylaxis. Anaphylaxis includes hives, facial or throat swelling, wheezing, lightheadedness, vomiting, and shock. Most anaphylactic reactions occur within 1 hour of taking a medication or receiving an injection of the medication, but sometimes the reaction may start several hours later. Anaphylaxis can result in death, so it's important to teach the patient to seek immediate medical attention if they experience any of those symptoms. Antibiotics are the most common culprit of anaphylaxis, but more recently, chemotherapy drugs and monoclonal antibodies have also been shown to induce anaphylaxis. The most severe form of delayed drug reaction not only causes rashes, but may also involve other organs including the liver, kidneys, lungs, and heart. Blisters may be a sign of serious drug reaction called Stevens-Johnson syndrome and toxic epidermal necrolysis, where the surface of the eyes, lips, mouth, and genital region may erode. Atopic dermatitis is a red to brownish gray coloring patches, and itching may be severe, especially at night. Small raised bumps which may leak fluid and crust over when scratched. The patient may also experience a thickened, cracked, or scaly skin. Atopic dermatitis is also known as eczema, and it may affect any area, but it classically appears on the arms and behind the knees. It tends to flare periodically and then subside. The cause of atopic dermatitis or eczema is unknown, but it may result from a malfunction in the body's immune system. Self-care measures such as avoiding soaps or other irritants and applying creams or ointments may help relieve the itching. Medical management is prophylactic measures and symptomatic relief, using non-drying soaps and moisturizers, cool compresses, oatmeal preparations, and antihistamines, and of course avoid the known triggers. Other treatments would be topical corticosteroids and ultraviolet light.